Hello, I'm Claire McAvoy from Phoenix Futures. I'm Service Manager for the Community Recovery Navigation team. So who are Phoenix Futures? Phoenix Futures are a national organisation running residential, community, young people and prison substance misuse services. In Barnsley, substance misuse services work under the umbrella of B Recovery, which is Barnsley Embracing Recovery, which is on the bottom of this slide. And that includes Phoenix Futures, AdAction, who run Tier 2 services, Swift and Swanswell, who run the carer service. So what do Phoenix Futures provide in Barnsley? We provide pharmacological interventions, psychosocial interventions, and recovery support interventions. John Strang, in the 2012 Medications in Recovery document, talks about phasing and layering. Phasing and layering a number of different interventions during an individual's treatment journey to engender movement and a recovery-orientated direction of travel. It allows us to provide different elements relevant to an individual's treatment need at any time. So most individuals in treatment will be in receipt of more than one of these interventions at any one time. So going on to talk about pharmacological interventions. Assessment and stabilisation. So assessment and stabilisation is titration from illicit substances through following thorough assessment and prescribing of a receptor antagonist such as methadone or a partial antagonist such as buprenorphine to stabilise an individual's use. Maintenance, prescribing of a substitute medication under a stable dose regime to medically manage physiological dependence and minimise illicit drug use, and to support an individual in achieving or sustaining medication-assisted recovery. Withdrawal, prescribing of an antagonist, partial antagonist or other medication to facilitate medically supervised assisted withdrawal and to manage withdrawal symptoms, and that's both for alcohol and opiates. And relapse prevention, which is prescribing medication for drug and alcohol relapse prevention support such as naltrexone or acamprosate. These interventions are offered both in the community and also on inpatient basis if these risks necessitate. So this element is currently delivered by our partners, South West Yorkshire Partnership Trust, and through GPs participating in the shared care model. So psychosocial interventions. Motivational interventions are there to resolve ambivalence for change, increase intrinsic motivation for change and self-efficacy. We provide contingency management, which is a system of reinforcement or incentives designed to motivate behaviour change and facilitate recovery. And we provide cognitive and behavioural relapse prevention. So to develop an individual's abilities to recognise, avoid or cope with thoughts, feelings and situations that are triggers to substance use. So both these can be delivered on a one-to-one basis or they can be delivered in a group setting. As well as one-to-one work with a recovery navigator, Phoenix has a structured day service where a group work programme is facilitated for individuals in various stages of their recovery journey. So from preparing individuals for change and supporting them in sustaining changes. And recovery support. So the National Drug Strategy 2010 talks about recovery capital, and recovery support is where most of this comes into play. It talks about the resources necessary to start and sustain recovery from drug and alcohol dependence, and these are some of the areas we deliver in service. So recovery support can be offered throughout treatment and after discharge, and is something individuals can rebuild futures without substances being around. So many of these are offered, sorry, keep skipping forward. Many of these are offered through onward referral, but we offer a number of these in-house as well. So we offer smart groups in-house, women's groups. We have a floating support service to offer housing support. We offer strengthening families group work for family support, complementary therapies as part of the group work programme, education and employment as part of the aftercare and resettlement team, and recovery checkups, which is ongoing support after somebody leaves treatment. If they agree, we can do regular checkups at 4 weeks, 3, 6 and 12 months. So I talked about phases of recovery, and in Barnsley Structured Services we work towards the continuum model. So the continuum model has 4 phases. Phase 1 is assess and allocate, where somebody's referred to the service and is assessed for their needs. They'll then move on to stage 2 if they're suitable for treatment, which is initiating recovery. So that may be that they're allocated to a nurse or a recovery navigator. And it's basically starting to make changes in their substance use. They then move on to establishing recovery, so they're starting to sustain some of those changes. Then on to sustaining recovery, so those changes they've started to make are consistent, and then they exit treatment and move into stable recovery. So in the packs I've given a couple of examples, and I'm just going to sort of read one of those out. So an example of a service user coming into service was a GP referral. A female aged 48 drinking 6 litres of 7.5% wine daily, which is 45 units. Stage 1, she was referred by a GP. She went through assessment and risk assessment and initial harm reduction advice. She was then referred on to preparation for recovery, which I'll talk about in a minute, and her initial recovery navigator appointment. Stage 2 was her first official appointment. She received recovery planning, further harm reduction techniques, work around reducing alcohol intake, identification of triggers and cravings, referral to Phoenix Futures group work programme, and she started to reduce, but she was unable to reduce further, so she was referred for a community detox. Stage 3, she undertook a community detox, completed it. She attended Phoenix Futures group work programme, ongoing one-to-one support with a recovery navigator, and received relapse prevention work. And then she moved on to stage 4, where she was referred on to peer support and mutual aid. She started attending training and education activities to develop skills, and then she was discharged from treatment. Remains abstinent and is volunteering as a peer mentor at a local project. So that's just one example. In the packs there are an opiate example and there's a non-opiate example as well, so just how people actually move through the treatment service. So who do we see? So various substances. And the gist of it is anybody over 18 with a problematic substance misuse who wants to make changes to their current use. We do have a lot of inappropriate referrals where people are just referred and don't really want to make any changes. There's not much point in referring somebody if they don't want to do anything about their use. So if they want to make changes, please refer them into services. Oh, there's a slide missing. The slide missing is in the packs, and it's about how to refer. So in your packs I've given you a referral form, and I've also included the audit and leads dependency questionnaire. So the audit that Gordon talked about earlier is really useful to us if you're making a referral into services. And then there's an LDQ, which is a lead dependency questionnaire, which is more useful for people who are using other substances other than alcohol. So, to referring to services, complete a referral form and fax it to the number that's in your pack, or call and make a referral via the telephone. And individuals can self-refer if needed through the same route. Please provide as much information as possible so we can make some sort of initial assessment on whether an individual is suitable for services. So the process following on from that is an appointment for an assessment will be given. So assessments primarily take place in the central services or at satellite services and can take up to an hour and a half. So please let your patients know how long they're sort of going to be expected to be in services. We do accommodate home visits where physical or psychological health issues identify a need for this, but ideally we'd like people to come into service because that shows a little bit of motivation actually getting to the service. We utilise interpreters with the aim of making service accessible to the wider community, and the next stage of that process is we ask individuals to attend what we call preparation for recovery. So before they actually come into treatment, we ask them to attend a session which is about expectations of them being in treatment and talking about their expectations of us as well. That's currently facilitated by Adaction, so they'd be expected to attend that before they actually are accepted into treatment. And then they'd be allocated a worker. Every GP practice in Barnsley has a named worker allocated to it because that's how we identify caseloads for clients. So everybody, even if you're not in the shared care model, everybody has a named recovery navigator and a named nurse for services. If you have room in your surgery, we will come and see clients in the surgery because some clients don't like to come into central services. So if you have got room, that's always a good thing. And then they'd be allocated a worker. So that is either a nurse or a recovery navigator, depending on their primary need at that time. Most opiate users coming into treatment will be allocated to a nurse initially to initiate prescribing. Other clients tend to go to a recovery navigator, but that can change throughout somebody's treatment journey. So, any questions?
Probably only got time for one question.
What's the time frame from initial referral to actually being seen at Phoenix Futures?
Time frame, we have a set time frame of 21. It has to be done within 21 days. At the minute, we're looking at between a week and 2 weeks. If somebody's got an identified need and needs to be seen quite urgently, though, we will facilitate that.